No, gaps and opportunities. We are saying that in organization culture, policy, processes, lived experience should be there. I think Basic Needs is really trying on this one to have the culture going beyond, the storytelling to actually having people like us involved in the processes in short-term and long-term projects, and even looking towards, meaningful engagement in terms of 5 years and so on. And so we need to build those cultures. And for a lot of you, because you also work with smaller organizations in research, when you begin to do this, you will influence other people in the 35 countries that you're working with and in the partners that you have. That within the policy is that the persons who are most affected by this are included. Formalizing opportunities by putting it in your policies, in governance, in decision making. And we have a slide where I will show how WHO has recommended for member states to do. Inclusion rights, like having it in policy and legislation. So like I said, being able to pull for rights. We used, and I think Edwin was my biggest supporter in this one, in claiming the WHO rights and saying that we are not included in these tables, according or as endorsed by the WHO and Ministry of Health Quality Rights for Mental Health, or the UN Convention, which has been ratified in our country and adopted in our Disability Act. But also, yes, this we will never say enough. Design, strategy, planning, implementation, M&D throughout the process. Addressing power balances, I think Rosemary has covered this, simple, accessible formats, because sometimes you leave us out in the jargon. You may not have this, discriminative language or stigmatizing language. But when you too much jargon or you make things complicated to do, then, we have those inequalities, because then we have people who are illiterate. And by the way, and even when most researches are online, it leaves out a lot of people. Because when I think of my fellow patients at Madari, they are left out of a lot of these, activities in strategy, in research. So I'm very happy that even the one we are doing with the University College of London has focused on county community health facilities in Lebanon and in Kenya at the very low level. And so that then becomes accessible. And I remember there's one we were doing for pregnant adolescents who have suicidal and self-harm tendencies. And we had to translate, not only into Swahili, but the sheng of the different places. So the sheng of Kangemi is different from Kariobangi, but we made it as accessible as possible. And that required redoing, some research processes. And then clearly defining involvement. We need to agree in advance. What is the purpose of my involvement? What are my responsibilities? What are the expectations? Are you able to build trust and accountability? Because you see, Edwin and I are sharing experience that we've earned over the last 5 years. But I can tell you, a lot of that time has not been paid. And so it means, even as you're asking, where do we get this money? We have put in our resources into teaching you, but we are uncompensated for it. And that has happened for me, even at the UN, at the WHO, at the African Union, at Africa CDC. It's crazy. It's absolutely crazy that I'm still doing this. So in terms of do's and don'ts, Welcome have a very good strategy. They are your partners, so you've probably seen this, but they talk about doing. I just copy-pasted it. I didn't want to water it down. So ensuring we are involved throughout the process, preliminary and full applications, which I think is what I was also talking about, even redoing the processes, recognizing our value. Yeah, the value that we bring as professionals, but even in that lived experience, the value that we bring that can be used from the research place. And you see, as researchers, you have so much influence, because everyone is looking to you to guide on how they would be able to look for funds. You are the evidence-based people. So when you provide this evidence and you say, as part of it, this evidence has also been collected by persons with lived experience who need to be involved in the projects that CSOs are doing, you have a lot of influence on that. Yes, multiple communities, contexts, mental health in Garissa and Kilifi are very different. Compensating, that one I probably cannot raise it better than Edwin has. It is important to pay, and I think the more we normalize it in our policies, the more even for donors and other people they will begin to normalize this. And there's a lot of push on lived experience pay, not only for mental health, but for the LGBTQ community, commercial sex workers, the homeless, persons living with HIV, and other many others. So this is a movement that is growing, and the issue of lived experience is quite needs attention. Acknowledging our contribution with even putting our names on these papers. I can tell you there's a very prestigious document that I've been named in, but no word I said is on that document, and that shouldn't happen. The don'ts are treating us as participants, rather than as experts or as partners throughout the process. Engaging us only for our stories. Like for me, my interest in advocacy and policy was not to share my story. It was to do policy. And sometimes I even prefer other people sharing their stories and I talk about policy. So there's a lot of not empathy. What do we call this one? Entitlement. There's a lot of entitlement of people to our stories, yet they are ours, and we choose how to say them and to use them. And even if we do have to, then they need to be respected and treated right. In terms of the personal information that we share, our journeys, and so on. Asking us to do small things that are not quantifiable, or being too rigid in involvement because we can contribute in many ways. Gaps and opportunities. Oh, sorry. I think those two slides came in between. So constituencies, like I was saying, even in the user caregiver, if it is mental health, we called people with bipolar, schizophrenia, like all across, and even the persons affected by dementia, the young, the old, people from counties, Kiambu County, Kilifi County, just having a wide range of people coming in, even for caregivers to be across, and even for media, we encourage them to get people from different backgrounds and experiences, because the experience of someone who has been treated by a traditional healer, treated in quotes, is very different from the one who's been treated by a spiritual healer, for example. Acknowledge our diverse experiences, perspectives, appropriate training through capacity building, person-centered language. So there are a lot of persons with lived experience who are very sensitive about the language used. I think I am guilty of, saying patients and caregivers when I'm speaking, especially to medics. But, there are people who will prefer person with lived experience with bipolar, or person living with bipolar, or, so it's easier to just ask someone, what is the name that dignifies you? Sustained community engagement, and this has to do with funding. And so what I'm saying is, uh, in your proposals, even as you're writing out, include that as part of the community that will be engaged are persons with lived experience, researchers. And so we are looking to, and we already come to the table disadvantaged, because there are more people who are poor, who are affected. Poverty, is a cause and effect of mental health conditions. And so by virtue of the illness itself, when we are coming to the table, we are less financially stable. By virtue of having to afford by using a lot of money in treatment, it puts us as a disadvantage. So consider that even as you have different people on the table in offering logistical and financial support that recognizes values and is accessible. So this is what I had mentioned, that the WHO in the framework, because the WHO guides governments. And so the guidelines they've given for themselves is what they have recommended for governments. So the first column is on remuneration. So this is what WHO should be doing, and we are really pushing them. Sorry. And so 100% at the paying lived experience at the same level with experts, providing funding for sustained engagement, and that means including it in the project design and to the end, and funding relevant activities. And this means sometimes even the best case scenario that we see. I mean, I think for the 50 meetings I've been to, I've only been facilitated probably for 10 of them, and that is for transport. And I'm giving my example not because I'm asking for myself, but where I am the best case scenario, many others have gone through a lot worse. Capacity building on the right of the screen is, the training that we need, even the research-based and evidence-based work that you have that can then support us to be able to do our work better, where we're able to say, yes, for mental health, 0.01% of the health budget. You giving us those statistics helps. Guidance and practice, collection, use of data, reform guidance. I'm just checking in case okay. And then establishing global and regional training, and this goes across from advocacy to policy and other processes as well. So in terms of Africa, because this is gold because there's a silver and there's bronze. The link is in the references. But in terms of Africa, we are lacking on research and evidence-based, contextualized, well-documented case studies of the best case scenario of lived experience, involvement, remuneration, capacity building. Because when you bring us 50 of us on the table and you get to see how much we lack that capacity building, or how much we've had to struggle even without being facilitated for transport, then being able to provide even a best case scenario of Edwin, for example, and showing that it has worked and showing examples from basic needs and others, then it would help other, because people, I mean, we tend to copy paste what we see. And so once it is done and documented well, then, and in videos and all that, then it would be easier for the different sectors to take it up in Africa. Guidelines, policies, frameworks. In terms of policies, like I said, yes, in terms of inclusion, yes, it's disability, but we do have global frameworks, which I think Rosemary went through. But since the task force, every other policy that has been there promotes lived experience, and you can use that to justify in your research. And so we are calling upon you, as a very influential research organization with a lot of influence on smaller research organizations, on civil society, to help us document and to give evidence-based, and to start with yourselves. To start with yourselves so that people are able to learn from you. So I think that's what I have for today. I'm happy to answer any questions that we have.